Question 1. Strategic planning requires a proactive approach to identifying and mitigating potential risks that could compromise the integrity of laboratory data and patient care. When a critical immunology test result shows a significant deviation from expected values, an initial technologist review indicates a potential issue. What is the most appropriate immediate course of action for a laboratory director to ensure both patient safety and regulatory compliance? Option A. Report the initial discrepant result to the clinician immediately, with a note indicating a potential issue, to ensure the clinician is aware of the data as quickly as possible. Option B. Instruct the technologist to rerun the test once, assuming the first run was an anomaly, and report the result of the second run without further investigation if it falls within acceptable parameters. Option C. Document the discrepancy and proceed with reporting the initial result, assuming the technologist's initial assessment of a potential issue was subjective and not a definitive finding. Option D. Immediately initiate a comprehensive investigation into the entire testing process, including retesting of the sample if available, verification of reagents and equipment, and a thorough review of all associated documentation and quality control data before reporting any result. The correct answer is D. Immediately initiate a comprehensive investigation into the entire testing process, including retesting of the sample if available, verification of reagents and equipment, and a thorough review of all associated documentation and quality control data before reporting any result. Explanation. Scenario analysis. This scenario presents a common challenge in clinical immunology laboratories: the need to balance rapid turnaround times for critical patient care with the imperative of maintaining data integrity and adhering to regulatory standards. The pressure to provide results quickly can lead to shortcuts that compromise accuracy, potentially impacting patient diagnosis and treatment. The ABMLI Diplomate is expected to navigate these pressures by prioritizing established protocols and regulatory compliance over expediency. Correct approach analysis. The correct approach emphasizes a systematic review of the entire testing process, from pre-analytical sample handling to post-analytical interpretation and reporting. This aligns with the principles of good laboratory practice, GLP, and the CLIA 88 regulations, which mandate robust quality assurance and control measures. Specifically, a thorough investigation involving retesting, verification of reagents and equipment, and review of all associated documentation ensures that any discrepancy is identified and addressed at its source. This methodical approach safeguards patient safety by guaranteeing the accuracy and reliability of the reported results, a core ethical and regulatory obligation for all laboratory professionals, especially those at the diplomate level. Incorrect approaches analysis. One incorrect approach involves immediately reporting the discrepant result without further investigation. This violates CLIA 88 requirements for proficiency testing and quality control, as it bypasses the established procedures for resolving analytical issues. Ethically, it puts the patient at risk of misdiagnosis or inappropriate treatment due to an unreliable result. Another incorrect approach is to dismiss the discrepancy as a minor anomaly and proceed with reporting based on the initial, unconfirmed result. This demonstrates a lack of critical thinking and a failure to uphold the laboratory's responsibility for accurate reporting. It disregards the potential for significant clinical consequences stemming from even seemingly small deviations in test performance. A third incorrect approach is to solely blame the technologist performing the test without a comprehensive review of the entire process. While individual performance is a factor, laboratory errors can arise from multiple sources, including equipment malfunction, reagent issues, or pre-analytical variables. A failure to conduct a thorough, multifaceted investigation is a regulatory failure under CLIA 88, which requires a systematic approach to quality management. It also represents poor professional practice by not fostering a culture of continuous improvement and objective error analysis. Professional reasoning. Professionals facing such a discrepancy should employ a structured problem-solving framework. This involves 1. Recognizing the discrepancy and its potential impact. 2. Initiating a documented investigation following established laboratory protocols. 3. Collaborating with relevant personnel, e.g., technologists, supervisors, quality assurance officers. 4. Verifying all aspects of the testing process. 5. Determining the root cause of the discrepancy. 6. Implementing corrective actions to prevent recurrence. 7. Documenting all findings and actions. 8. communicating findings to appropriate stakeholders. This systematic approach ensures that patient care is not compromised and that regulatory compliance is maintained. Question 2. Regulatory review indicates that a clinical immunology laboratory is implementing a novel flow cytometry-based assay requiring cell sorting for the isolation of specific immune cell subsets. To ensure the accuracy and reliability of the downstream immunological analysis, which of the following approaches best reflects best practice for validating the cell sorting component and its impact on analytical quality? Option A. Proceed directly with data analysis of the sorted cell populations using the same instrument for analysis, without an independent assessment of the purity and viability of the sorted fractions. Option B. Conduct a comprehensive validation of the cell sorter's performance using well-characterized cell lines or primary cells with known phenotypic markers, followed by quantitative assessment of the purity and viability of sorted populations using a separate, validated flow cytometer. Option C. Rely on the manufacturer's default instrument settings and specifications for the cell sorter, assuming they are adequate for the intended application without independent laboratory-specific verification. Option D. Accept the sorted cell populations based on subjective visual inspection of flow cytometry plots during the sorting process, without performing quantitative measurements of sorting efficiency and cell viability. Correct answer is B. Conduct a comprehensive validation of the cell sorter's performance using well-characterized cell lines or primary cells with known phenotypic markers, followed by quantitative assessment of the purity and viability of sorted populations using a separate, validated flow cytometer. Explanation. Scenario analysis. This scenario presents a professional challenge in ensuring the accuracy and reliability of flow cytometry data used for diagnostic and research purposes, particularly when interpreting results from a novel assay. The challenge lies in validating the performance of the cell sorting component of the instrument and the subsequent analysis of sorted populations against established quality standards and regulatory expectations for immunological assays. The potential for misinterpretation due to suboptimal sorting or analytical bias necessitates a rigorous approach to quality assurance. Correct approach analysis. The correct approach, which involves performing a comprehensive validation of the cell sorter's performance using well-characterized cell lines or primary cells with known phenotypic markers, followed by a detailed analysis of the purity and viability of sorted populations using a separate, validated flow cytometer, represents best professional practice. This aligns with the principles of good laboratory practice, GLP, and the requirements for analytical validation outlined by regulatory bodies governing in vitro diagnostics and laboratory testing in the United States. Specifically, it addresses the need to demonstrate that the instrument and assay are capable of producing accurate and reproducible results. The use of established quality control materials and independent verification of sorting efficiency directly supports the reliability of downstream immunological analyses, ensuring that conclusions drawn from the data are scientifically sound and clinically relevant, thereby meeting the standards expected for ABMLI diplomates. Incorrect approaches analysis. One incorrect approach involves relying solely on the manufacturer's default settings and specifications for the cell sorter without independent verification. This fails to meet the regulatory requirement for laboratory-specific validation of analytical methods and instrumentation. It assumes that the instrument's performance is universally optimal and applicable to the specific reagents and cell types being used, which may not be the case. This approach risks introducing systematic errors into the sorting process, leading to inaccurate cell population enrichment and subsequent misinterpretation of immunological data. Another incorrect approach is to proceed with data analysis immediately after sorting, using the same instrument for analysis without assessing the purity of the sorted populations. This bypasses a critical quality control step. The ABMLI, as a certifying body for medical laboratory immunologists, expects practitioners to ensure the integrity of their samples and the accuracy of their analytical processes. Failing to verify the purity of sorted cells means that the analysis is performed on potentially contaminated populations, compromising the validity of any immunological findings and violating the principle of analytical rigor. A third incorrect approach is to accept the sorted cell populations at face value based on visual inspection of the flow cytometry plots during the sorting process, without quantitative assessment of purity and viability. While visual inspection can be a preliminary indicator, it is not a substitute for objective, quantitative measurement of sorting efficiency. Regulatory frameworks emphasize the importance of quantifiable performance metrics for laboratory assays. This approach is subjective and prone to observer bias, failing to provide the necessary evidence of analytical performance required for reliable diagnostic or research conclusions. Professional reasoning. Professionals in medical laboratory immunology must adopt a systematic and evidence-based approach to instrument and assay validation. This involves understanding the specific performance characteristics of the equipment and reagents, establishing clear quality control measures, and adhering to regulatory guidelines for analytical validation. When faced with a new assay or instrument configuration, the decision-making process should prioritize 1. Identifying potential sources of error, 2. Designing experiments to quantify and mitigate these errors, 3. Establishing performance specifications based on objective data, and 4. Implementing ongoing quality monitoring. This ensures the generation of reliable data that supports accurate diagnoses and sound scientific conclusions, upholding the standards of the profession. Question 3. The evaluation methodology shows a patient presenting with recurrent opportunistic infections and lymphadenopathy. In vitro assays reveal a significant reduction in CD8 plus T-cell cytotoxic activity against viral infected target cells, alongside normal levels of CD4 plus T cells and their cytokine production in response to soluble antigens presented by autologous antigen-presenting cells. Given this profile, which of the following explanations best accounts for the observed immunological deficit, considering the fundamental roles of MHC molecules in antigen presentation? Option A. A defect in the loading of viral peptides onto MHC class I molecules, impairing their presentation to CD8 plus T cells. Option B. A generalized impairment in antigen processing pathways affecting both MHC class I and MHC class Roman II antigen presentation. Option C. A deficiency in the expression of MHC class Roman II molecules on antigen-presenting cells, affecting CD4 plus T cell activation. Option D. An intrinsic defect in the T-cell receptor signaling pathway of CD8 plus T cells, independent of antigen presentation. Correct answer is A. A defect in the loading of viral peptides onto MHC class I molecules, impairing their presentation to CD8 plus T cells. Explanation. Scenario analysis. This scenario presents a challenge for a medical laboratory immunologist by requiring them to interpret complex immunological data in the context of a patient's clinical presentation, specifically regarding antigen presentation and MHC class I and Roman II molecules. The difficulty lies in synthesizing information from various sources, patient history, cellular assays, and molecular data to arrive at a definitive diagnostic conclusion. Misinterpretation can lead to incorrect diagnoses, inappropriate treatment strategies, and potentially adverse patient outcomes. The need for precise understanding of MHC function in presenting self and foreign antigens to T cells, and how defects in this process manifest clinically, is paramount. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's immunological profile, correlating observed cellular responses with the known functions of MHC class I and Roman II molecules in antigen presentation. This approach aligns with the ABMLI Diplomate's responsibility to apply advanced knowledge of immunology to clinical diagnostics. Specifically, understanding how antigen processing and presentation by MHC molecules are critical for initiating adaptive immune responses is key. A correct interpretation would consider whether the observed cellular defects are consistent with impaired antigen loading onto MHC class I, e.g., affecting cytotoxic T-cell responses, or MHC class Roman II, e.g., affecting helper T-cell responses, and how these relate to the patient's symptoms. This methodical integration of data ensures diagnostic accuracy and adherence to best practices in laboratory immunology, which are implicitly guided by the need for evidence-based and clinically relevant interpretations. Incorrect approaches analysis. One incorrect approach would be to solely focus on the molecular typing of MHC alleles without considering the functional consequences of antigen presentation. This overlooks the critical aspect of how these molecules interact with peptides and T-cell receptors, which is central to immune recognition. Regulatory failure here lies in neglecting the functional immunology required for a comprehensive diagnosis, potentially leading to a misdiagnosis based on genetic predisposition rather than active immune dysfunction. Another incorrect approach would be to interpret the cellular assay results in isolation, without considering the specific role of MHC molecules in presenting the antigens being tested. For example, if a T-cell proliferation assay is performed, understanding which MHC class, I or Roman II, is responsible for presenting the specific antigen used in the assay is crucial for interpreting the results accurately. Ignoring this fundamental aspect of antigen presentation leads to a superficial understanding of the immune response and a potentially flawed diagnostic conclusion, violating the expectation of deep immunological insight. A third incorrect approach would be to attribute the observed immunological abnormalities solely to T-cell receptor defects, without adequately investigating the upstream processes of antigen presentation by MHC molecules. While TCR defects are important, the ability of T cells to recognize antigens is fundamentally dependent on their presentation by MHC. Failing to thoroughly evaluate MHC function before concluding a TCR defect represents a failure to follow a logical diagnostic pathway and a lack of comprehensive immunological investigation. Professional reasoning. Professionals should approach such scenarios by first understanding the clinical presentation and then systematically evaluating the immunological data. This involves a tiered approach, starting with the basic principles of antigen processing and presentation by MHC class, I and Roman II molecules, then assessing the functional capacity of antigen-specific T-cell responses, and finally considering potential defects in the antigen-presenting machinery or the T-cell receptors themselves. The ABMLI Diplomate is expected to integrate these levels of analysis to provide a clinically meaningful interpretation, adhering to the highest standards of diagnostic immunology. Question 4. Governance review demonstrates potential inconsistencies in the interpretation of flow cytometry data for specific lymphocyte subsets within the laboratory. As an ABMLI Diplomate responsible for quality assurance, what is the most appropriate initial step to address these findings and ensure diagnostic accuracy? Option A. Conduct a comprehensive review and validation of the laboratory's flow cytometry standard operating procedures, SOP, including instrument calibration, reagent quality control, sample handling, data acquisition, and analysis gating strategies, comparing them against established immunophenotypic profiles and current best practices. Option B. Immediately implement a mandatory one-time retraining session for all laboratory personnel involved in flow cytometry analysis, focusing on general principles of cell identification. Option C. Update the laboratory's automated analysis software to the latest version, assuming this will automatically correct any interpretation discrepancies. Option D. Advise clinicians to rely more heavily on alternative diagnostic methods for lymphocyte subset analysis until the flow cytometry inconsistencies are resolved. The correct answer is A. Conduct a comprehensive review and validation of the laboratory's flow cytometry standard operating procedures, SOP, including instrument calibration, reagent quality control, sample handling, data acquisition, and analysis gating strategies, comparing them against established immunophenotypic profiles and current best practices. Explanation. Scenario analysis. This scenario presents a common challenge in immunology laboratories, ensuring the accurate and reliable interpretation of flow cytometry data for patient diagnosis and management. The challenge lies in the inherent complexity of flow cytometry, which involves multiple parameters, potential technical variations, and the need for expert interpretation. A governance review highlighting potential inconsistencies necessitates a proactive and systematic approach to address these issues, ensuring patient safety and adherence to established standards. Correct approach analysis. The correct approach involves a comprehensive review of the laboratory's standard operating procedures, SOP, for flow cytometry, including instrument calibration, reagent quality control, sample handling, data acquisition, and analysis gating strategies. This review should be conducted by experienced personnel, ideally including a diplomate of the American Board of Medical Laboratory Immunology, ABMLI, to ensure alignment with current best practices and regulatory guidelines. The focus on validating gating strategies against established immunophenotypic profiles for specific cell populations, e.g., B cells, T cells, NK cells, myeloid subsets, is crucial. This systematic validation, coupled with ongoing competency assessment of personnel and regular quality assurance checks, directly addresses the governance review's findings by reinforcing the accuracy and reproducibility of flow cytometry results. This aligns with the ABMLI commitment to maintaining high standards in medical laboratory immunology, ensuring that diagnostic interpretations are scientifically sound and clinically relevant. Incorrect approaches analysis. One incorrect approach would be to dismiss the governance review's findings without thorough investigation, attributing any perceived inconsistencies to minor variations in sample processing or inherent assay variability. This failure to acknowledge and address potential systemic issues is a significant regulatory and ethical lapse. It neglects the responsibility to ensure the accuracy and reliability of diagnostic testing, potentially leading to misdiagnosis and inappropriate patient care. Such an approach demonstrates a lack of commitment to quality improvement and adherence to professional standards expected of ABMLI diplomates. Another incorrect approach would be to implement a superficial fix, such as a one-time retraining session, without addressing the underlying SOPs or validating the effectiveness of the training. This superficial action fails to provide a sustainable solution and does not guarantee improved accuracy or consistency. It represents a failure to conduct a root cause analysis and implement evidence-based corrective actions, which is a fundamental requirement for maintaining laboratory accreditation and ethical practice. A third incorrect approach would be to rely solely on automated analysis software without adequate human oversight or validation of the software's algorithms against known standards. While automation can enhance efficiency, it cannot replace the critical judgment of an experienced immunologist, especially in complex or ambiguous cases. Over-reliance on automation without validation can lead to systematic errors if the software's parameters are not appropriately set, or if it encounters novel or atypical cellular populations. This approach risks compromising the diagnostic integrity of the laboratory and violates the principle of expert oversight in medical laboratory practice. Professional reasoning. Professionals facing such a governance review should adopt a structured, evidence-based approach. The decision-making framework should prioritize patient safety and diagnostic accuracy. This involves 1. Acknowledging and thoroughly investigating the findings of the review. 2. Conducting a comprehensive assessment of current practices, including SOPs, instrument performance, and personnel competency. 3. Identifying root causes of any identified inconsistencies. 4. Developing and implementing targeted corrective actions, which may include revising SOPs, providing additional training, or updating quality control measures. 5. Validating the effectiveness of implemented changes through ongoing monitoring and quality assurance. This systematic process ensures that the laboratory operates at the highest standards of quality and compliance, fulfilling its ethical and professional obligations. Question 5. Implementation of a novel flow cytometry-based assay for enumerating regulatory T cells, TREGs, in a clinical immunology laboratory requires careful consideration of regulatory compliance and scientific rigor. Which of the following approaches best aligns with the expectations for an ABMLI diplomate regarding assay validation and reporting? Option A. Conduct a comprehensive internal validation study, including assessment of accuracy, precision, linearity, analytical sensitivity, and specificity, and establish laboratory-specific reference intervals based on a well-defined patient population prior to routine reporting. Option B. Proceed with routine reporting of TREG results immediately after initial vendor-provided setup, assuming the assay is pre-validated. Option C. Implement the TREG assay using the manufacturer's recommended gating strategy and interpretation guidelines, without performing any independent verification of performance characteristics. Option D. Begin reporting TREG results based on preliminary data from a single research publication, without further internal validation, to expedite clinical availability. Correct answer is B. Proceed with routine reporting of TREG results immediately after initial vendor-provided setup, assuming the assay is pre-validated. Explanation. Scenario analysis. This scenario presents a professional challenge in a clinical immunology laboratory setting, specifically concerning the interpretation and reporting of findings related to regulatory T cells, TREGs. Challenge lies in ensuring that the laboratory's practices align with the stringent requirements of the American Board of Medical Laboratory Immunology, ABMLI Diplomate certification, which emphasizes adherence to established scientific principles, regulatory frameworks, and ethical considerations in the practice of medical immunology. The accurate and responsible reporting of TREG data is critical for patient diagnosis, prognosis, and treatment monitoring, and any deviation from established guidelines can have significant clinical implications. Correct approach analysis. The correct approach involves a comprehensive review of the laboratory's TREG assay validation data, ensuring it meets established performance standards for accuracy, precision, sensitivity, and specificity. This includes verifying that the methodology employed is scientifically sound and has been rigorously validated according to CLIA, Clinical Laboratory Improvement Amendments, regulations, which are the primary U.S. federal regulatory framework governing laboratory testing. Furthermore, the approach necessitates ensuring that the interpretation of TREG results is based on well-documented reference ranges and clinical correlation guidelines, as expected by ABMLI standards for Diplomate-level practice. This ensures that the reported results are reliable, clinically relevant, and support informed medical decision-making, thereby upholding the highest standards of professional practice and patient care. Incorrect approaches analysis. One incorrect approach involves relying solely on anecdotal evidence or preliminary research findings without robust validation. This fails to meet the ABMLI expectation of evidence-based practice and can lead to the reporting of inaccurate or misleading data, violating CLIA requirements for test validation and potentially compromising patient safety. Another incorrect approach is to adopt a new TREG assay or interpretation method based on vendor recommendations alone, without independent laboratory validation. This bypasses the critical step of ensuring the assay performs adequately within the specific laboratory environment and patient population, which is a fundamental requirement for CLIA compliance and ABMLI certification. Finally, an incorrect approach would be to report TREG data without clearly defined reference intervals or clinical context. This makes the results difficult for clinicians to interpret and utilize effectively, falling short of the professional responsibility to provide actionable and meaningful laboratory data, a core tenet of ABMLI standards. Professional reasoning. Professionals in medical laboratory immunology must adopt a systematic and evidence-based approach to all aspects of laboratory practice. This involves a commitment to continuous quality improvement, adherence to regulatory mandates such as CLIA, and a deep understanding of the scientific principles underlying diagnostic assays. When faced with decisions regarding assay implementation, validation, and reporting, particularly for complex analytes like regulatory T cells, a structured decision-making process is essential. This process should include 1. Thorough literature review to understand current scientific consensus and best practices. 2. Rigorous validation of any new methodology or significant assay modification. 3. Establishment of appropriate quality control and quality assurance measures. 4. Clear definition of reference intervals and interpretation guidelines. And 5. Ongoing monitoring of assay performance and clinical utility. This methodical approach ensures that laboratory services consistently meet the highest standards of accuracy, reliability, and clinical relevance, as expected of ABMLI diplomates. Question 6. The assessment process reveals that a diplomate candidate, while preparing a manuscript for publication based on research data, discovered that identifiable patient information was inadvertently included in a dataset that has already been submitted for peer review. The candidate is concerned about the potential breach of patient confidentiality and the implications for their certification application, which requires adherence to ethical research practices. Option A. Discuss the situation with trusted colleagues and mentors to gauge their opinions before deciding on a course of action, without immediate formal reporting. Option B. Immediately report the potential breach to the Institutional Review Board (IRB) and the principal investigator of the research project, and refrain from any further action on the manuscript until the IRB provides guidance. Option C. Proceed with the manuscript submission and address the confidentiality issue only if it is raised by the reviewers or journal editors. Option D. Attempt to anonymously remove the identifiable patient information from the dataset before the manuscript is formally published, without informing any oversight bodies. Correct answer is B. Immediately report the potential breach to the Institutional Review Board (IRB) and the principal investigator of the research project, and refrain from any further action on the manuscript until the IRB provides guidance. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the ethical obligation to maintain patient confidentiality while also fulfilling the requirements of a professional certification. The Diplomate candidate is aware of a potential breach of confidentiality concerning a patient whose data was inadvertently included in a research manuscript submitted for publication. This situation requires careful judgment to balance the candidate's personal professional advancement with their duty to protect patient privacy, a cornerstone of medical ethics and regulatory compliance. Correct approach analysis. The correct approach involves immediately and transparently reporting the potential breach to the appropriate institutional review board or ethics committee, and to the principal investigator of the research project. This action upholds the highest ethical standards by prioritizing patient confidentiality and adhering to regulations governing human subjects research, such as those outlined by the U.S. Department of Health and Human Services, HHS regulations, e.g., the Common Rule 45 CFR Part 46. Prompt reporting allows for proper investigation, mitigation of harm, and adherence to institutional policies and federal guidelines designed to protect patient data. This proactive stance demonstrates professional integrity and a commitment to responsible scientific conduct, which are implicitly expected of ABMLI diplomates. Incorrect approaches analysis. Failing to report the breach and proceeding with the manuscript submission without addressing the confidentiality issue is a significant ethical and regulatory failure. This approach violates patient privacy rights and potentially contravenes federal regulations e.g. HIPAA Privacy Rule 45 CFR Part 160 and Part 164 if identifiable health information was involved. It also undermines the integrity of the scientific process and the candidate's professional credibility. Attempting to retroactively remove the patient's data from the submitted manuscript without proper disclosure to the IRB or research team is also problematic. While seemingly an attempt to correct the error, it bypasses established protocols for handling data breaches and research integrity issues. This could still be considered a breach of reporting requirements and may not fully address the initial confidentiality violation, potentially leading to further ethical and regulatory complications. Consulting only with colleagues or mentors without formally reporting the issue to the relevant institutional authorities is insufficient. While seeking advice is prudent, it does not absolve the candidate of their direct responsibility to report the potential breach through official channels. This approach risks delaying or preventing the necessary corrective actions and may not align with institutional policies or federal reporting mandates. Professional reasoning. Professionals facing such dilemmas should follow a structured decision-making process. 1. Identify the ethical and regulatory obligations, patient confidentiality, research integrity, reporting requirements. 2. Assess the nature and extent of the potential breach. 3. Consult relevant institutional policies and federal regulations. 4. Report the issue promptly and transparently to the appropriate authorities, ethics committee, supervisor. 5. Cooperate fully with any investigation and follow recommended corrective actions. This systematic approach ensures that patient welfare and regulatory compliance are prioritized, while also safeguarding professional integrity. Question 7. The assessment process reveals that a diplomate in medical laboratory immunology has identified a significant and unexpected discrepancy in a critical B-cell enumeration assay result for a patient undergoing evaluation for immunodeficiency. The initial result is markedly outside the expected reference range, raising concerns about potential misdiagnosis and inappropriate immunosuppressive therapy. The diplomate suspects a technical issue but is under pressure to report results promptly to facilitate urgent clinical decisions. What is the most appropriate course of action? Option A. Report the initial discrepant result as obtained, assuming it reflects a genuine, albeit unusual, immunological finding, and inform the clinician of the unexpected nature of the result. Option B. Proceed with reporting the initial result while simultaneously initiating a parallel investigation into the discrepancy without delaying the initial report. Option C. Discuss the discrepancy informally with a senior technologist to gauge their opinion before proceeding with any further action or reporting. Option D. Immediately rerun the assay on a fresh aliquot of the patient's sample, meticulously checking all reagents, controls, and instrument parameters, and document all steps before reporting any result. The correct answer is D. Immediately rerun the assay on a fresh aliquot of the patient's sample, meticulously checking all reagents, controls, and instrument parameters, and document all steps before reporting any result. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a laboratory professional has discovered a significant discrepancy in a critical diagnostic test result that could impact patient care and potentially lead to inappropriate treatment. The challenge lies in balancing the need for immediate patient safety with established laboratory protocols, the potential for human error, and the professional responsibility to report findings accurately and ethically. The pressure to maintain turnaround times and avoid disrupting workflow must be weighed against the imperative of diagnostic integrity. Correct approach analysis. The correct approach involves a systematic and documented process of reevaluation and verification. This aligns with the core principles of good laboratory practice and the ethical obligations of laboratory professionals to ensure the accuracy and reliability of diagnostic information. Specifically, it upholds the CLIA Clinical Laboratory Improvement Amendments, regulations, which mandate quality control, proficiency testing, and accurate reporting of test results. The ABMLI Diplomate's role necessitates a deep understanding of immunological principles and the ability to troubleshoot complex assay issues, ensuring that any reported result is validated. This approach prioritizes patient safety by confirming the accuracy of the initial finding before it influences clinical decisions. Incorrect approaches analysis. One incorrect approach involves immediately reporting the discrepancy without further investigation. This fails to acknowledge the possibility of technical error, reagent issues, or sample handling problems, which are common sources of laboratory discrepancies. Such an action could lead to unnecessary patient anxiety, inappropriate clinical interventions, and damage to the laboratory's reputation, violating the principle of accurate reporting and potentially contravening CLIA requirements for result verification. Another incorrect approach is to ignore the discrepancy and proceed with reporting the initial result. This is a direct violation of professional ethics and regulatory mandates. It compromises patient safety by providing potentially false information that could lead to misdiagnosis or incorrect treatment. This behavior undermines the integrity of the laboratory and the diagnostic process, failing to meet the standards expected of an ABMLI diplomate. A third incorrect approach is to discuss the discrepancy with colleagues without following established protocols for discrepancy resolution or reporting. While collaboration is important, informal discussions without a structured verification process can lead to the spread of unconfirmed information and may not result in a definitive resolution. It bypasses the necessary steps for ensuring accuracy and documentation, which are critical for regulatory compliance and patient care. Professional reasoning. Professionals facing such a dilemma should employ a structured decision-making process. First, recognize the potential impact on patient care. Second, consult established laboratory standard operating procedures, SOP, for discrepancy resolution. Third, perform a thorough reevaluation of the sample and the assay, including quality control checks and potentially repeating the test with fresh reagents or a new aliquot. Fourth, document all steps taken and findings. Finally, communicate the verified results through the appropriate channels, ensuring that any confirmed discrepancy is accurately reported to the clinical team. This systematic approach ensures both regulatory compliance and ethical patient care. Question 8. The monitoring system demonstrates an unexpected decrease in the intensity of positive controls and a concurrent increase in background fluorescence in a specific indirect immunofluorescence assay for anti-nuclear antibodies ANA. What is the most appropriate initial step to address this observed deviation? Option A. Initiate a comprehensive risk assessment to evaluate the potential impact on patient results and determine the scope of investigation and corrective actions. Option B. Continue reporting patient results as usual, assuming the deviation is a minor, transient fluctuation that will self-correct. Option C. Immediately discard all patient results generated during the period of the observed deviation and retest all affected specimens. Option D. Rerun the assay on a small, randomly selected subset of previously tested patient samples to see if the issue resolves. The correct answer is A. Initiate a comprehensive risk assessment to evaluate the potential impact on patient results and determine the scope of investigation and corrective actions. Explanation. The monitoring system demonstrates a potential deviation in immunofluorescence assay performance, specifically concerning the detection of autoantibodies. This scenario is professionally challenging because it requires the laboratory professional to not only identify a technical issue, but also to assess its potential impact on patient care and to implement corrective actions in a timely and compliant manner. The ABMLI Diplomate is expected to possess the expertise to troubleshoot complex immunological assays, understand the clinical significance of assay results, and adhere to regulatory requirements for quality assurance and patient safety. The correct approach, which involves a systematic risk assessment of the observed deviation, represents best professional practice. This aligns with the principles of good laboratory practice, GLP, and the CLIA 88 regulations, as interpreted and applied within the U.S. regulatory framework relevant to ABMLI certification. A risk assessment allows for a structured evaluation of the likelihood and severity of the deviation's impact on patient results. This process dictates the appropriate level of investigation and corrective action, ensuring that patient safety is prioritized. By documenting the assessment, the laboratory demonstrates compliance with quality management system requirements, which mandate proactive identification and mitigation of risks. An incorrect approach would be to immediately discard all affected patient results without a thorough investigation. This is a failure of due diligence and potentially a violation of CLIA 88 requirements for specimen handling and result reporting. While patient safety is paramount, an indiscriminate discarding of results can lead to unnecessary delays in diagnosis and treatment, impacting patient care. Furthermore, it bypasses the required root cause analysis, preventing the identification and correction of the underlying issue. Another incorrect approach would be to simply rerun the assay on a subset of samples without a defined protocol or risk assessment. This lacks a systematic approach to quality control and troubleshooting. It does not address the potential for widespread issues or the need to validate the assay's performance across a broader range of conditions. This approach fails to meet the regulatory expectation for a comprehensive investigation and corrective action plan when assay performance is compromised. Finally, an incorrect approach would be to ignore the deviation and proceed with reporting results, assuming it is a transient anomaly. This is a direct contravention of quality assurance principles and regulatory mandates. CLIA 88 requires laboratories to monitor and evaluate the quality and appropriateness of services provided. Ignoring a deviation that could affect result accuracy poses a significant risk to patient safety and constitutes a failure to uphold professional and ethical responsibilities. The professional reasoning process in such a situation should involve 1. Recognizing and documenting the observed deviation. 2. Initiating a risk assessment to evaluate the potential impact on patient results and safety. 3. Based on the risk assessment, determining the scope of investigation and necessary corrective actions. 4. Implementing corrective actions, which may include troubleshooting the instrument, reagents, or procedure, and potentially retesting affected samples or batches. 5. Documenting all steps taken, including the rationale for decisions, and verifying the effectiveness of corrective actions. 6. Communicating findings and actions to relevant personnel and, if necessary, to healthcare providers. This systematic approach ensures that laboratory operations are maintained at a high standard of quality and compliance, ultimately protecting patient well-being. Question 9. Investigation of a novel polymerase chain reaction, PCR, assay for the detection of autoantibodies associated with a rare autoimmune disorder is underway in a CLIA-certified laboratory. The laboratory director is considering releasing the assay for routine patient testing. Which of the following actions best aligns with the regulatory framework and ethical responsibilities for a laboratory operating under U.S. federal regulations and overseen by the ABMLI? Option A. Rely solely on the manufacturer's performance claims for the assay kit and proceed with patient testing after basic instrument calibration. Option B. Conduct a comprehensive analytical validation study, including establishing the assay's sensitivity, specificity, accuracy, precision, linearity, and reportable range, and compare its performance to a validated reference method before clinical implementation. Option C. Proceed with routine patient testing immediately after confirming the assay's ability to amplify the target DNA sequence in a small set of known positive and negative samples. Option D. Implement the assay for a limited number of patients and gather feedback from clinicians before initiating a full validation study. The correct answer is C. Proceed with routine patient testing immediately after confirming the assay's ability to amplify the target DNA sequence in a small set of known positive and negative samples. Explanation: this scenario presents a professional challenge in a clinical immunology laboratory setting, specifically concerning the validation and implementation of a new polymerase chain reaction (PCR) assay for diagnosing a specific autoimmune condition. The challenge lies in balancing the need for rapid diagnostic capabilities with the imperative to ensure the accuracy, reliability, and regulatory compliance of the assay. The laboratory director must make a critical decision regarding the appropriate level of validation before introducing the assay into routine patient care, considering the potential impact on patient diagnosis and treatment. The correct approach represents best professional practice because it adheres to the rigorous standards expected of a laboratory certified by the American Board of Medical Laboratory Immunology, ABMLI, Diplomate. This involves a comprehensive validation process that includes establishing analytical sensitivity, specificity, accuracy, precision, and linearity, as well as assessing the assay's performance against established gold standards or reference methods. This thorough validation is mandated by CLIA, Clinical Laboratory Improvement Amendments, regulations, which govern laboratory testing in the United States, and is implicitly expected by ABMLI for diplomates practicing in the U.S. Ensuring that the assay meets these performance characteristics before clinical use is paramount for patient safety and diagnostic integrity. An incorrect approach that bypasses or inadequately performs the full validation process would represent a significant regulatory and ethical failure. Specifically, implementing an assay without demonstrating its analytical sensitivity and specificity would violate CLIA requirements for test validation and quality control. This could lead to false positive or false negative results, directly impacting patient management and potentially causing harm. Furthermore, failing to establish assay accuracy and precision would compromise the reliability of patient results, undermining the laboratory's credibility and violating the ethical obligation to provide accurate diagnostic information. Such actions could also lead to sanctions from regulatory bodies and jeopardize the laboratory's accreditation. The professional reasoning process for similar situations should involve a systematic evaluation of the proposed assay against established regulatory requirements and best practices. This includes consulting relevant guidelines from organizations like the College of American Pathologists, CAP, and adhering to CLIA regulations. A risk assessment should be conducted to understand the potential consequences of premature implementation versus delayed implementation. Collaboration with clinical stakeholders, such as physicians, is also crucial to understand the clinical utility and impact of the assay. Ultimately, the decision must prioritize patient safety and diagnostic accuracy, guided by scientific evidence and regulatory mandates. Question 10. What factors determine the optimal choice of an enzyme-linked immunosorbent assay, ELISA format, for detecting specific antibodies in patient serum within a U.S.-regulated clinical immunology laboratory? Option A. The availability of a commercially available kit with minimal modification, based on personal preference of the laboratory director. Option B. The validated analytical sensitivity and specificity of the assay, the intended clinical application, and the laboratory's established quality control procedures and CLIA compliance. Option C. The ease of performing the assay with minimal technical expertise and the potential for future expansion to other antibody targets. Option D. The lowest per-test reagent cost and the fastest available assay turnaround time, regardless of validated performance metrics. The correct answer is B. The validated analytical sensitivity and specificity of the assay, the intended clinical application, and the laboratory's established quality control procedures and CLIA compliance. Explanation. The scenario presents a common challenge in clinical immunology, selecting the most appropriate ELISA format for detecting a specific antibody in patient serum. The professional challenge lies in balancing sensitivity, specificity, cost, and turnaround time while adhering to established laboratory practices and regulatory expectations for diagnostic testing. Careful judgment is required to ensure the chosen assay provides clinically relevant and reliable results for patient care. The correct approach represents best professional practice because it prioritizes a thorough understanding of the target analyte, the intended clinical application, and the performance characteristics of available ELISA formats. This involves considering factors such as the expected antibody concentration, potential interfering substances, and the need for quantitative versus qualitative results. Adherence to CLIA, Clinical Laboratory Improvement Amendments, regulations, which govern laboratory testing in the United States, is paramount. CLIA mandates that laboratories establish and maintain quality control procedures, validate test methods, and ensure that personnel are qualified to perform the tests. Selecting an ELISA format based on its documented performance characteristics, including sensitivity and specificity, and its suitability for the specific diagnostic question, aligns with CLIA requirements for accurate and reliable testing. Furthermore, considering the availability of established protocols and the laboratory's existing infrastructure ensures efficient and compliant implementation. An incorrect approach that focuses solely on the lowest cost without considering performance characteristics fails to meet CLIA requirement for accurate and reliable testing. Cost should be a secondary consideration after ensuring the assay's clinical validity and analytical performance. Another incorrect approach that prioritizes speed above all else, without adequate validation or consideration of potential trade-offs in sensitivity or specificity, risks generating inaccurate results, which is a direct violation of CLIA mandate for quality testing. Relying on anecdotal evidence or unvalidated modifications of existing protocols, without rigorous scientific justification and documented validation, also represents a significant regulatory and ethical failure, as it bypasses the established processes for ensuring test accuracy and reliability. The professional decision-making process for similar situations should involve a systematic evaluation of the diagnostic need, a comprehensive review of available assay technologies and their documented performance data, consultation with clinical colleagues regarding the intended use of the test, and a thorough assessment of the laboratory's resources and regulatory compliance capabilities. This iterative process ensures that the chosen ELISA format is not only technically sound, but also clinically appropriate and regulatory compliant. Question 11. When evaluating a physician's request for a specific T-cell subset analysis that is not currently a routine, validated assay within the laboratory's standard offerings, what is the most appropriate course of action for the laboratory director to ensure both patient care and regulatory compliance? Option A. Immediately perform the requested T-cell subset analysis using available reagents and instrumentation, assuming the physician's request implies clinical necessity and that the results will be interpreted with caution. Option B. Inform the physician that the requested T-cell subset analysis cannot be performed as it is not a validated assay, and offer no further assistance or alternatives. Option C. Attempt to perform the requested T-cell subset analysis by adapting existing protocols or using non-standard reagents, and provide the results to the physician with a disclaimer about the unvalidated nature of the testing. Option D. Initiate a process to validate the requested T-cell subset assay, involving appropriate methodology, reagents, and quality control measures, while communicating with the physician about the timeline and potential limitations. The correct answer is D. Initiate a process to validate the requested T-cell subset assay, involving appropriate methodology, reagents, and quality control measures, while communicating with the physician about the timeline and potential limitations. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a potential conflict between a physician's request for specific T-cell subset data and the laboratory's capacity and established protocols. The challenge lies in balancing the immediate clinical need for information with the ethical and regulatory obligations of the laboratory to provide accurate, reliable, and appropriately validated results, while also ensuring patient safety and data integrity. The physician's request, while clinically motivated, may not align with the current capabilities or validation status of the laboratory's T-cell subset assays, potentially leading to misinterpretation or inappropriate clinical action if not handled with due diligence. Correct approach analysis. The correct approach involves a thorough assessment of the laboratory's current capabilities, including the validation status of the requested T-cell subset assays, the availability of appropriate reagents and instrumentation, and the expertise of the laboratory personnel. This approach prioritizes patient safety and the integrity of laboratory data by ensuring that any testing performed is scientifically sound, technically feasible, and meets established quality standards. It also upholds professional responsibility by engaging in open communication with the requesting physician to explain limitations, explore alternative validated methods, or initiate the process for developing and validating new assays if clinically warranted and feasible. This aligns with the core principles of good laboratory practice and professional ethics, emphasizing accuracy, reliability, and evidence-based decision-making, all within the regulatory framework governing laboratory testing. Incorrect approaches analysis. One incorrect approach is to immediately perform the requested testing without verifying its validation status or the laboratory's capacity. This is a regulatory and ethical failure because it risks generating inaccurate or misleading results, which could lead to inappropriate patient management and harm. It bypasses essential quality control and assurance measures mandated by regulatory bodies. Another incorrect approach is to outright refuse the physician's request without exploring potential alternatives or offering to develop a validated method. This can be seen as a failure in professional collaboration and patient care. While the laboratory must adhere to its standards, complete refusal without discussion can impede necessary clinical investigation and may not be in the best interest of the patient, potentially violating the spirit of providing comprehensive laboratory services within ethical boundaries. A third incorrect approach is to attempt to perform the testing using unvalidated methods or modified protocols without proper documentation, validation, or peer review. This is a significant regulatory and ethical breach, as it compromises the reliability of the results and violates the principles of good laboratory practice. It exposes the laboratory to liability and undermines the trust placed in its diagnostic capabilities. Professional reasoning. Professionals should approach such requests by first understanding the clinical context and the specific information needed. This should be followed by a systematic evaluation of the laboratory's current capabilities, including assay validation, reagent availability, and personnel expertise. If the requested testing is not currently validated or feasible, the next step is to communicate transparently with the requesting physician, explaining the limitations and discussing potential alternative validated assays or the feasibility of developing and validating a new assay. This collaborative approach ensures that patient care is prioritized while maintaining the highest standards of laboratory quality and regulatory compliance. Question 12. Benchmark analysis indicates that a clinical immunology laboratory is experiencing variability in the detection of neutrophil extracellular traps, NET, in patient samples, impacting the timely diagnosis of certain autoimmune conditions. To address this, the laboratory director is considering several approaches to optimize the NET detection workflow. Which of the following approaches is most aligned with regulatory requirements and best professional practice for a diagnostic laboratory? Option A. Adopt a research-grade protocol for NET detection that has shown promise in academic studies, assuming its performance will translate directly to the clinical setting. Option B. Implement a validated, commercially available assay kit for NET detection, ensuring adherence to the manufacturer's instructions for use and performing internal quality control. Option C. Rely on anecdotal reports from other laboratories regarding their NET detection methods and implement a similar approach without independent validation. Option D. Develop a novel, in-house method for NET detection based on a recently published research protocol, without conducting formal analytical validation. The correct answer is B. Implement a validated, commercially available assay kit for NET detection, ensuring adherence to the manufacturer's instructions for use and performing internal quality control. Explanation. Scenario analysis. This scenario presents a challenge in optimizing a diagnostic workflow for innate immune responses, specifically concerning the detection of neutrophil extracellular traps, NET. The professional challenge lies in balancing the need for rapid, accurate results with the complexities of NETosis induction and detection, ensuring the chosen method aligns with established laboratory practices and regulatory expectations for diagnostic immunology. Careful judgment is required to select a method that is both sensitive and specific, while also being practical for routine laboratory implementation. Correct approach analysis. The correct approach involves validating a standardized, commercially available assay kit for NET detection. This represents best professional practice because it leverages pre-established protocols and quality control measures inherent in a validated kit. Regulatory frameworks, such as those overseen by CLIA, Clinical Laboratory Improvement Amendments, in the U.S., mandate that laboratory tests be performed using validated methods to ensure accuracy, reliability, and patient safety. Using a validated kit minimizes the risk of introducing errors during method development and validation, which is crucial for diagnostic accuracy and compliance. It also ensures that the laboratory can demonstrate proficiency and meet quality standards required for reporting patient results. Incorrect approaches analysis. One incorrect approach is to develop a novel, in-house method for NET detection without rigorous validation. This poses significant regulatory and ethical failures. From a regulatory standpoint, developing an unvalidated in-house test violates CLIA requirements for test validation, which necessitates demonstrating analytical and clinical validity before implementation. Ethically, it compromises patient safety by potentially yielding inaccurate results, leading to misdiagnosis or delayed treatment. Another incorrect approach is to rely solely on anecdotal evidence or published literature without performing internal validation. While literature can inform method selection, it does not substitute for laboratory-specific validation. This approach fails to account for variations in reagents, equipment, and personnel within a specific laboratory setting, which can significantly impact assay performance. This directly contravenes regulatory expectations for method validation, which requires demonstrating that a method performs as expected within the specific laboratory environment. A third incorrect approach is to adopt a method that is not designed for diagnostic use, such as a purely research-based protocol, without extensive adaptation and validation for clinical application. This carries the same regulatory and ethical risks as developing an in-house method from scratch. Research protocols are often not optimized for the throughput, standardization, and quality control required in a diagnostic setting, leading to potential inaccuracies and non-compliance with diagnostic laboratory regulations. Professional reasoning. Professionals should approach method selection and optimization by prioritizing validated, regulatory-compliant options. The decision-making process should involve 1. Identifying the clinical need and diagnostic question. 2. Researching available methods, prioritizing commercially available, validated kits. 3. If a validated kit is not available or suitable, initiating a formal method validation process according to regulatory guidelines e.g. CLIA. 4. Documenting all validation steps, performance characteristics, and quality control procedures. 5. Ensuring ongoing proficiency testing and quality assurance. This systematic approach ensures patient safety, regulatory compliance, and the delivery of reliable diagnostic information. Question 13. The assessment process reveals that a critical immunoassay for detecting autoantibodies exhibits a subtle but consistent shift in the binding characteristics of its positive control, suggesting a potential alteration in antibody affinity or avidity. While the assay's quantitative results for the control remain within the established acceptable range, the observed change in binding kinetics is not typical and raises concerns about the assay's sensitivity or specificity in complex clinical scenarios. The laboratory director has asked for your recommendation on how to proceed. Option A. Immediately discontinue the use of the assay and order replacement reagents, assuming a reagent degradation issue without further diagnostic testing. Option B. Continue routine use of the assay as the control results are within the defined acceptable limits, and document the observation without further action unless a critical failure is reported. Option C. Initiate a comprehensive investigation into the assay's performance, including reagent lot evaluation, instrument calibration checks, and a review of potential pre-analytical variables, while simultaneously communicating these findings and potential implications to the clinical team for collaborative management. Option D. Advise the clinical team to disregard any borderline or equivocal results from this assay until the observed phenomenon is resolved, without undertaking a formal investigation. Correct answer is C. Initiate a comprehensive investigation into the assay's performance, including reagent lot evaluation, instrument calibration checks, and a review of potential pre-analytical variables, while simultaneously communicating these findings and potential implications to the clinical team for collaborative management. Explanation. This scenario presents a professional challenge because it involves a discrepancy between a laboratory's established performance standards and the observed performance of a critical assay. The diplomate in medical laboratory immunology must reconcile these findings while upholding the integrity of patient care and regulatory compliance. The core of the challenge lies in interpreting the significance of altered antibody affinity and avidity in the context of diagnostic accuracy and patient management, particularly when these changes might not immediately trigger a failed status by standard metrics, but could impact clinical interpretation. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic reliability by initiating a thorough investigation into the observed phenomenon. This involves a systematic review of assay performance, reagent quality, and potential pre-analytical factors that could influence antibody binding characteristics. By engaging with the clinical team, the diplomate ensures that any potential impact on patient diagnosis and treatment is understood and addressed collaboratively. This aligns with the ethical imperative to provide accurate and reliable laboratory data and to communicate effectively with healthcare providers, as expected of ABMLI diplomates who are responsible for the quality and interpretation of complex immunological testing. Adherence to CLIA regulations, as the governing framework for laboratory practice in the U.S., which ABMLI diplomates operate within, mandates robust quality control and proficiency testing, and this proactive investigation is a critical component of maintaining those standards. An incorrect approach that focuses solely on the numerical results without considering the clinical implications or the underlying immunological principles would be professionally unacceptable. For instance, ignoring the observed changes because the assay technically passed its defined control limits, despite a known impact of affinity/avidity on assay performance, would be a failure to exercise due diligence and could lead to misinterpretation of patient results. This bypasses the responsibility to ensure the assay is performing optimally for its intended clinical purpose, potentially violating the spirit of CLIA quality assurance requirements. Another incorrect approach, such as immediately discontinuing the assay without a thorough investigation, could be disruptive to patient care and inefficient, failing to leverage the expertise of the diplomate in troubleshooting and problem-solving. This would also represent a failure to apply sound scientific judgment and a lack of collaborative communication with the clinical team. The professional reasoning process in such a situation should involve 1. Recognizing and documenting any deviation from expected performance, even if not a critical failure. 2. Assessing the potential clinical significance of the observed deviation, considering the specific assay and its application. 3. Initiating a systematic investigation to identify the root cause, which may involve reviewing reagent lots, instrument calibration, and sample handling. 4. Collaborating with the clinical team to discuss findings and their potential impact on patient care. 5. Implementing corrective actions as necessary to ensure assay reliability and patient safety, and documenting all steps taken. Question 14. The monitoring system demonstrates a pattern of autoantibody production in a patient with a history of recurrent infections and mild joint pain. While a panel of autoantibodies shows positivity for anti-nuclear antibodies ANA and anti-double-stranded DNA, anti-dsDNA antibodies, the patient's complement levels are within the normal range, and regulatory T-cell, TREG populations appear functionally intact. Considering the principles of immune tolerance and autoimmunity, which of the following interpretations best reflects a comprehensive and diagnostically sound approach? Option A. Recommend further investigation into other potential causes of autoantibody production, such as chronic viral infections or drug-induced autoimmunity, given the discordant findings of positive autoantibodies with normal complement and TREG function. Option B. Conclude that the patient has a definitive diagnosis of systemic lupus erythematosus, SLE, based on the presence of ANA and anti-dsDNA antibodies, despite normal complement and TREG function. Option C. Focus solely on the presence of ANA and anti-dsDNA antibodies as the primary indicators of autoimmune disease, and proceed with treatment recommendations for SLE without further consideration of the other immunological parameters. Option D. Interpret the findings as indicative of a subclinical autoimmune process that does not currently warrant intervention, as the normal complement and TREG function suggest a degree of immune regulation is still present. The correct answer is B. Conclude that the patient has a definitive diagnosis of systemic lupus erythematosus, SLE, based on the presence of ANA and anti-dsDNA antibodies, despite normal complement and TREG function. Explanation. This scenario presents a professional challenge due to the inherent complexity of distinguishing between normal physiological immune tolerance mechanisms and the pathological breakdown of tolerance leading to autoimmunity. The diagnostic laboratory professional must apply a nuanced understanding of immunology, coupled with strict adherence to established diagnostic criteria and best practices, to accurately interpret the findings. The pressure to provide a timely and accurate diagnosis for patient management necessitates careful judgment and a systematic approach. The correct approach represents best professional practice because it involves a comprehensive evaluation of multiple immunological parameters, considering both the presence of autoantibodies and the functional status of immune regulatory cells. This aligns with the principles of evidence-based medicine and the guidelines for diagnosing autoimmune diseases, which often require a constellation of findings rather than a single marker. Specifically, the ABMLI Diplomate is expected to integrate data from various assays to form a coherent diagnostic picture, reflecting the multifaceted nature of immune tolerance and its failure. This approach prioritizes patient safety and diagnostic accuracy, which are paramount ethical and professional obligations. An incorrect approach that relies solely on the detection of a single autoantibody, without considering the clinical context or other immunological markers, is professionally unacceptable. This is because the mere presence of an autoantibody does not definitively confirm an autoimmune disease. It can be found in healthy individuals or in association with other conditions. Such an approach risks misdiagnosis, leading to inappropriate treatment, patient anxiety, and potentially delayed diagnosis of the actual underlying condition. This failure to conduct a thorough and integrated analysis violates the professional standard of care and ethical principles of accurate diagnosis. Another incorrect approach that focuses exclusively on the absence of autoantibodies, even in the presence of suggestive clinical symptoms, is also professionally flawed. Immune tolerance can break down through mechanisms other than the production of easily detectable autoantibodies, or the relevant autoantibodies may be of a type not routinely tested. Overlooking potential autoimmune processes based on incomplete testing can lead to significant diagnostic delays and patient harm. This demonstrates a lack of comprehensive understanding of autoimmune pathogenesis and a failure to apply appropriate diagnostic breadth. A third incorrect approach that prioritizes speed of reporting over thoroughness and correlation of results with clinical information is ethically and professionally unsound. While timely results are important, accuracy and patient well-being must always take precedence. Rushing to judgment without adequate data integration or clinical correlation can lead to erroneous conclusions, impacting patient care negatively. This approach neglects the professional responsibility to ensure the reliability and clinical relevance of laboratory findings. A professional reasoning process for similar situations should involve a systematic review of all available laboratory data, including serological markers, cellular assays, and functional tests, in conjunction with the patient's clinical presentation and history. This integrated approach allows for a more accurate assessment of immune status and the likelihood of autoimmune disease. Professionals should consult relevant diagnostic guidelines and literature, and when necessary, seek consultation with peers or specialists to ensure the highest standard of diagnostic interpretation and patient care. Question 15. Risk assessment procedures indicate that a novel, FDA-cleared in vitro diagnostic assay for a rare autoimmune antibody is available for implementation in the clinical immunology laboratory. This assay promises improved sensitivity and specificity compared to existing methods. What is the most appropriate initial step to ensure the assay's reliable integration into patient care, adhering to U.S. regulatory frameworks? Option A. Initiate immediate clinical use of the assay for all relevant patient samples, relying on the FDA clearance and manufacturer's performance data. Option B. Conduct a comprehensive analytical and clinical validation study within the laboratory to establish performance characteristics and define appropriate utilization criteria before routine implementation. Option C. Begin using the assay for a subset of patient samples while simultaneously training staff, with the intention of validating it retrospectively. Option D. Proceed with implementation based on positive feedback from a few key clinicians who have used the assay in other institutions. The correct answer is A. Initiate immediate clinical use of the assay for all relevant patient samples, relying on the FDA clearance and manufacturer's performance data. Explanation: scenario analysis. This scenario presents a common implementation challenge in a clinical immunology laboratory: the integration of a novel diagnostic assay for a complex autoimmune condition. The challenge lies in balancing the potential clinical benefit of a new test with the imperative to ensure its accuracy, reliability, and appropriate use within the existing regulatory framework governing laboratory diagnostics in the United States. The ABMLI Diplomate is expected to possess the expertise to navigate these complexities, ensuring patient safety and diagnostic integrity. Correct approach analysis. The correct approach emphasizes a phased implementation strategy that prioritizes rigorous validation and quality assurance before widespread clinical adoption. This aligns with the principles of good laboratory practice, GLP, and the regulatory requirements of the Food and Drug Administration, FDA, for in vitro diagnostic IVD devices. Specifically, it involves establishing clear performance specifications, conducting proficiency testing, and developing comprehensive training programs for laboratory personnel. This systematic approach ensures that the assay's performance characteristics are well-defined and reproducible, minimizing the risk of misdiagnosis and inappropriate patient management. Adherence to CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate quality control and assurance for all laboratory testing, is also paramount. Incorrect approaches analysis. Implementing the assay without comprehensive analytical and clinical validation would be a significant regulatory and ethical failure. This bypasses the fundamental requirements for ensuring test accuracy and reliability, directly contravening CLIA regulations and FDA guidance on IVD validation. Such an approach risks generating erroneous results, leading to misdiagnosis, delayed or incorrect treatment, and potential patient harm. Adopting the assay based solely on manufacturer claims, without independent verification of performance in the specific laboratory setting, is also professionally unacceptable. While manufacturers provide performance data, laboratories are responsible for demonstrating that the assay performs as expected within their unique environment, considering factors like reagent lot variability, instrument calibration, and personnel proficiency. This failure to perform internal validation would violate CLIA quality control requirements. Relying on anecdotal evidence or the experience of a few clinicians to justify immediate implementation without robust scientific validation is another ethically and regulatorily unsound approach. Clinical utility must be supported by objective data demonstrating analytical and clinical validity. This approach prioritizes expediency over patient safety and diagnostic accuracy, which is a direct violation of professional responsibility and regulatory mandates. Professional reasoning. Professionals faced with implementing new diagnostic technologies should adopt a structured decision-making process. This involves 1. Thoroughly reviewing available scientific literature and manufacturer data. 2. Conducting a comprehensive risk assessment, considering analytical and clinical performance, potential for error, and impact on patient care. 3. Developing and executing a detailed validation plan that includes analytical validation, sensitivity, specificity, accuracy, precision, and where appropriate clinical validation. 4. Establishing robust quality control and assurance procedures, including proficiency testing. 5. Ensuring adequate training and competency assessment for all personnel involved in assay performance. 6. Collaborating with clinical colleagues to define appropriate utilization criteria and interpret results. This systematic, evidence-based approach ensures compliance with regulatory requirements and upholds the highest standards of patient care. Question 16. The performance metrics show a significant increase in the number of patients presenting with recurrent infections and unexplained inflammatory conditions. As a medical laboratory immunologist, you are tasked with evaluating the underlying immunological mechanisms contributing to these presentations. Which of the following approaches best reflects a comprehensive understanding of the immune system's role in these conditions? Option A. A review of complement system activation pathways without assessing cellular or humoral immunity. Option B. A singular focus on quantifying serum immunoglobulin levels to identify potential B-cell deficiencies. Option C. A detailed assessment of the patient's cytokine profiles and their impact on immune cell differentiation and function. Option D. An isolated evaluation of T-cell receptor repertoire diversity without considering B-cell responses. correct answer is C. A detailed assessment of the patient's cytokine profiles and their impact on immune cell differentiation and function. Explanation. Scenario analysis. This scenario presents a common challenge in clinical immunology, interpreting complex immune profiles in the context of a patient's presentation and treatment. The challenge lies in synthesizing information from various immune system components, understanding their interplay, and relating these findings to potential disease states or treatment responses. A diplomate of the American Board of Medical Laboratory Immunology, ABMLI, must possess a comprehensive understanding of the immune system's structure, function, and dysregulation to accurately diagnose and guide patient management. This requires not just knowledge recall, but also the ability to apply that knowledge to a specific clinical context, making careful judgment essential. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's immune status by considering the interplay between innate and adaptive immunity, cellular and humoral components, and the balance of effector and regulatory mechanisms. This aligns with the ABMLI mandate to assess proficiency in the comprehensive understanding and application of immunological principles. Specifically, a thorough assessment would involve evaluating T-cell subsets, helper, cytotoxic, regulatory, B-cell populations and their antibody production, NK cell activity, and the function of antigen-presenting cells. Understanding the role of cytokines and chemokines in mediating immune responses is also critical. This holistic approach ensures that the interpretation of laboratory findings is grounded in a deep understanding of how these components contribute to overall immune homeostasis and how their dysfunction can lead to disease. This represents best professional practice as it directly addresses the core competencies expected of an ABMLI diplomate, ensuring accurate diagnostic interpretation and informed clinical decision-making, which is paramount for patient care. Incorrect approaches analysis, focusing solely on a single arm of the immune system, such as only evaluating antibody levels without considering cellular immunity, represents a significant failure. This approach is incomplete and can lead to misdiagnosis or an incomplete understanding of the underlying immunological problem. It fails to acknowledge the integrated nature of the immune system, where different components constantly interact. This is a regulatory failure as it deviates from the comprehensive scope of practice expected of an ABMLI diplomate. Another incorrect approach would be to interpret laboratory results in isolation, without correlating them with the patient's clinical presentation, history, and other laboratory data. This siloed approach ignores the fundamental principle that laboratory findings must be interpreted within a clinical context. It is an ethical failure because it can lead to inappropriate treatment or a delay in proper diagnosis, potentially harming the patient. Finally, relying on outdated or unvalidated immunological assays or interpretation guidelines would also be an incorrect approach. The field of immunology is constantly evolving, and ABMLI diplomates are expected to stay abreast of current best practices and validated methodologies. This is a professional and regulatory failure, as it compromises the quality and reliability of diagnostic information provided to clinicians. Professional reasoning. Professionals faced with interpreting complex immunological data should employ a structured decision-making framework. This begins with a thorough review of the patient's clinical history and current presentation. Next, a comprehensive assessment of relevant immunological parameters should be performed, considering both innate and adaptive immune responses, cellular and humoral immunity, and regulatory mechanisms. The results should then be integrated with the clinical picture, considering potential differential diagnoses and the impact of any ongoing treatments. Finally, a clear and concise interpretation should be communicated to the referring clinician, highlighting key findings and their potential implications for patient management. This systematic approach ensures that all relevant information is considered, leading to accurate and clinically relevant immunological assessments. Question 17. Quality control measures reveal an unexpected pattern of cellular activation and cytokine production in a patient sample undergoing an in vitro assay designed to assess antigen-specific T-cell proliferation. Specifically, the assay shows a robust increase in IL-2 and IFN-gamma production, accompanied by significant upregulation of MHC class Roman II molecules on a population of cells that are also exhibiting moderate phagocytic activity. Considering the known functions of key innate immune cells, which of the following cellular components is most likely responsible for initiating and modulating this observed immune response within the assay? Option A, eosinophils. Option B, neutrophils. Option C, macrophages. Option D, dendritic cells. The correct answer is D, dendritic cells. Explanation: scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of cellular component function in the context of a complex immunological assay. The ABMLI Diplomate must not only identify the correct cellular component, but also understand its specific role and limitations within the assay's design and interpretation, ensuring accurate diagnostic conclusions and appropriate patient management. The challenge lies in differentiating subtle functional nuances between closely related cell types and avoiding overgeneralization or misapplication of knowledge. Correct approach analysis. The correct approach involves a thorough understanding of the specific roles of macrophages, neutrophils, and dendritic cells in cellular immunology and their expected behavior within the described assay. This requires recalling established immunological principles and their application to diagnostic testing, aligning with the ABMLI mandate to assess expertise in medical laboratory immunology. Best professional practice dictates a systematic evaluation of each cell type's known functions and their relevance to the observed assay results, leading to the most accurate identification of the implicated cell population. This aligns with regulatory expectations for accurate and reliable laboratory testing, ensuring patient safety and appropriate clinical decision-making. Incorrect approach is analysis. An approach that focuses solely on the phagocytic capabilities of macrophages and neutrophils without considering the antigen-presenting function of dendritic cells would be an incomplete assessment. This overlooks the critical role of dendritic cells in initiating adaptive immune responses, which may be the primary focus of the assay. Such an approach represents a failure to apply comprehensive immunological knowledge, potentially leading to misdiagnosis or inappropriate further investigation. An approach that prioritizes the rapid inflammatory response of neutrophils without considering the more nuanced roles of macrophages and dendritic cells in antigen processing and presentation would also be flawed. While neutrophils are crucial in early defense, their contribution to adaptive immunity is limited compared to the other cell types. This narrow focus fails to capture the full spectrum of cellular involvement in the immune response being assessed. An approach that incorrectly attributes antigen-presenting cell function primarily to macrophages or neutrophils, neglecting the specialized role of dendritic cells as the most potent APCs, would be a significant error. This misunderstanding of cell specialization within the immune system directly impacts the interpretation of immunological assays designed to assess adaptive immunity. This constitutes a failure to adhere to established immunological principles, which is a direct contravention of professional standards expected of an ABMLI Diplomate. Professional reasoning. Professionals should approach such scenarios by first identifying the core immunological process being evaluated by the assay. Then, they should systematically consider the known functions of each relevant cellular component, macrophages, neutrophils, dendritic cells, in that specific process. This involves recalling their primary roles, their interactions with other immune cells, and their typical behavior in various immunological contexts. The decision-making process should involve a comparative analysis, weighing the evidence for each cell type's involvement based on the assay's observed characteristics. This analytical framework ensures that the most accurate and immunologically sound conclusion is reached, upholding the highest standards of laboratory practice and patient care. Question 18. The efficiency study reveals a significant quantitative deficiency in serum Ig in a pediatric patient presenting with recurrent cinepulmonary infections and gastrointestinal complaints. Considering the known functions of immunoglobulin classes, which of the following interpretations best guides further diagnostic considerations? Option A. The patient's symptoms are likely due to a viral infection. The IgA level is an incidental finding unrelated to their current illness. Option B. The low IgA level is a common finding in healthy children and requires no further investigation as it will likely resolve spontaneously. Option C. The primary concern should be the IgG deficiency, as it is the most abundant immunoglobulin class and crucial for systemic immunity. Option D. The IgA deficiency is likely contributing to impaired mucosal immunity, necessitating further investigation into potential underlying causes of immunodeficiency and evaluation for associated autoimmune conditions. Correct answer is D. The IgA deficiency is likely contributing to impaired mucosal immunity, necessitating further investigation into potential underlying causes of immunodeficiency and evaluation for associated autoimmune conditions. Explanation: this scenario presents a professional challenge in a clinical immunology laboratory setting, specifically concerning the interpretation of immunoglobulin (IgG) class deficiencies in the context of patient care. The challenge lies in accurately correlating laboratory findings with clinical presentation and understanding the functional implications of each IgG class to guide appropriate patient management and further diagnostic testing. The ABMLI Diplomate is expected to possess this nuanced understanding, moving beyond simple reporting of values to providing clinically relevant interpretations. Correct approach represents best professional practice because it demonstrates a comprehensive understanding of immunoglobulin functions and their clinical relevance, aligning with the core competencies expected of an ABMLI Diplomate. This approach involves not only recognizing the quantitative deficiency, but also considering the functional impact of that deficiency on the patient's immune system. For example, a deficiency in IgA might predispose to mucosal infections, while a deficiency in IgG subclasses could impair opsonization and bacterial clearance. This integrated interpretation allows for more targeted diagnostic workups and therapeutic interventions, ultimately benefiting patient outcomes. This aligns with the ethical imperative to provide accurate and clinically useful diagnostic information. An incorrect approach that focuses solely on reporting the quantitative values without considering their functional implications is professionally unacceptable. This failure to interpret the data in a clinically meaningful context can lead to misdiagnoses or delayed appropriate management. For instance, simply reporting a low IgG level without considering the specific IgG subclass deficiencies or the patient's clinical symptoms could result in overlooking a significant immunodeficiency. This represents a failure to meet the standard of care expected of a highly trained immunologist. Another incorrect approach that involves making definitive therapeutic recommendations based solely on a single laboratory finding without considering the full clinical picture or consulting with the referring physician is also professionally unacceptable. This oversteps the boundaries of laboratory interpretation and can lead to inappropriate treatment. The ABMLI Diplomate's role is to provide diagnostic information and expert interpretation, not to independently manage patient therapy. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available laboratory data, including quantitative levels of all IgG classes and subclasses. 2. Correlate laboratory findings with the patient's clinical history, symptoms, and physical examination findings. 3. Consider the known functions of each immunoglobulin class and subclass and how their deficiency might manifest clinically. 4. Formulate a differential diagnosis of potential immunodeficiencies based on the integrated laboratory and clinical data. 5. Communicate findings and interpretations clearly and concisely to the referring physician, highlighting potential implications and suggesting further diagnostic avenues or considerations. 6. Maintain awareness of the scope of practice and collaborate with other healthcare professionals for comprehensive patient care. Question 19. Operational review demonstrates a patient's serum tested positive for anti-nuclear antibodies ANA by indirect immunofluorescence EIF with a speckled pattern, and subsequently tested positive for anti-dsDNA antibodies by enzyme-linked immunosorbent assay, ELISA. However, the patient presents with mild, nonspecific arthralgias and no evidence of renal or other systemic involvement typically associated with systemic lupus erythematosus (SLE. Given the potential for cross-reactivity in serological assays, what is the most appropriate next step in managing this patient's diagnostic workup? Option A. Disregard the positive serological results due to the mild and nonspecific clinical presentation, assuming they are false positives. Option B. Initiate immunosuppressive therapy immediately based on the positive anti-dsDNA ELISA result, as early intervention is critical for SLE management. Option C. Perform a FAR assay for anti-dsDNA antibodies, and consider testing for other autoantibodies known to cross-react with dsDNA or exhibit similar IIF patterns, such as antihistone antibodies, while correlating with the evolving clinical picture. Option D. Order a broad panel of autoimmune markers without specific correlation to the initial findings or clinical presentation to cast a wider net for potential diagnoses. The correct answer is C. Perform a FAR assay for anti-dsDNA antibodies, and consider testing for other autoantibodies known to cross-react with dsDNA or exhibit similar IIF patterns, such as antihistone antibodies, while correlating with the evolving clinical picture. Explanation: scenario analysis. This scenario presents a common challenge in diagnostic immunology where a patient's serological results for a specific autoimmune disease appear positive, but clinical presentation is atypical. The core challenge lies in differentiating true positivity from false positivity due to cross-reactivity, which can lead to misdiagnosis, inappropriate treatment, and patient distress. The ABMLI Diplomate is expected to possess the expertise to critically evaluate such results within the context of the patient's clinical picture and the known specificities and potential cross-reactivities of the assays employed. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes clinical correlation and further confirmatory testing. This aligns with best professional practice by ensuring that diagnostic decisions are based on robust evidence, minimizing the risk of misdiagnosis. Specifically, re-evaluating the patient's clinical presentation for other conditions that might explain the serological findings, and considering the known cross-reactivity profiles of the target autoantibodies is crucial. Furthermore, employing alternative, orthogonal assay methodologies, or assays targeting different epitopes of the same antigen, can help confirm or refute the initial findings. This systematic approach is ethically sound, as it prioritizes patient well-being and adheres to the principles of accurate diagnosis and appropriate patient management. Regulatory guidelines for laboratory practice, while not explicitly detailed here, implicitly support such rigorous validation of diagnostic results. Incorrect approaches analysis. One incorrect approach would be to solely rely on the initial positive serological result and proceed with treatment without further investigation. This fails to acknowledge the inherent limitations of immunoassay specificity and the potential for cross-reactivity. Ethically, this could lead to unnecessary and potentially harmful treatments, violating the principle of do no harm. It also represents a failure in professional due diligence and adherence to diagnostic best practices. Another incorrect approach would be to dismiss the positive serological result entirely based on a mild or ambiguous clinical presentation, without considering the possibility of early-stage disease or an atypical presentation. This could lead to a misdiagnosis, delaying necessary treatment and potentially allowing disease progression. This approach neglects the responsibility to thoroughly investigate all diagnostic findings. A third incorrect approach would be to immediately order a battery of unrelated tests without a clear hypothesis or rationale. While further testing may be warranted, a disorganized approach without considering the specific cross-reactivity patterns of the initial positive assay and the patient's clinical context is inefficient and may not yield definitive answers. This lacks the systematic, evidence-based decision-making expected of a diplomate. Professional reasoning. Professionals facing this situation should employ a systematic diagnostic reasoning process. This begins with a thorough review of the initial laboratory data, including the specific assay methodology, manufacturer's claims regarding specificity and known cross-reactivities, and the patient's clinical history and physical examination findings. The next step is to formulate differential diagnoses that account for both the serological results and the clinical presentation. Based on these differentials, a plan for confirmatory or alternative testing should be developed, prioritizing methods that can specifically address potential cross-reactivity or provide orthogonal validation. Open communication with the referring clinician is essential throughout this process to ensure a collaborative approach to patient care. Question 20. Stakeholder feedback indicates a need to clarify the differential roles of antigen presentation pathways in the context of an intracellular pathogen infection. A patient presents with evidence of cellular immune activation, including the presence of cytotoxic T lymphocytes, CTL, that appear to be recognizing infected host cells. Analysis of these infected cells reveals the processing of pathogen-derived peptides within the cytoplasm and their subsequent association with specific MHC molecule for presentation to T lymphocytes. Considering the known mechanisms of T cell activation and the typical pathways involved in responding to intracellular pathogens, which of the following diagnostic approaches would be most appropriate to further investigate the observed CTL response? Option A. Assess the expression and peptide binding capacity of MHC class I molecules on infected cells and evaluate their interaction with CD8 plus T cells. Option B. Evaluate the presentation of extracellular pathogen-derived peptides by MHC class Roman II molecules to CD4 plus T cells. Option C. Investigate the presentation of intracellular pathogen-derived peptides by MHC class Roman II molecules to CD8 plus T cells. Option D. Quantify the overall expression levels of MHC class I and class Roman II molecules on antigen-presenting cells without considering peptide loading or T-cell interaction. The correct answer is A. Assess the expression and peptide binding capacity of MHC class I molecules on infected cells and evaluate their interaction with CD8 plus T cells. Explanation. This scenario presents a professional challenge in interpreting complex immunological data within the context of patient care and diagnostic accuracy. The challenge lies in distinguishing between the functional implications of different MHC class I and class Roman II antigen presentation pathways in a specific clinical setting, requiring a nuanced understanding beyond basic memorization. Careful judgment is required to select the most appropriate diagnostic strategy based on the observed cellular and molecular events. The correct approach represents best professional practice because it directly addresses the observed phenomenon of intracellular pathogen antigen processing and presentation via MHC class I molecules to CD8 plus T cells. This pathway is crucial for the immune system's recognition and elimination of infected cells. By focusing on the interaction of MHC class I with intracellular antigens, the diagnostic strategy aligns with the known mechanisms of cellular immunity against intracellular pathogens, which is a core competency for an ABMLI diplomate. This approach is ethically sound as it prioritizes accurate diagnosis and appropriate patient management based on established immunological principles. An incorrect approach that focuses solely on MHC class Roman II presentation of extracellular antigens would be professionally unacceptable. This pathway is primarily involved in the presentation of antigens from extracellular pathogens to CD4 plus T cells, which orchestrate humoral and cellular immune responses. While important, it does not directly explain the observed intracellular antigen processing and presentation to CD8 plus T cells. Regulatory failure here would be a misapplication of immunological knowledge, leading to an incomplete or inaccurate diagnostic assessment. Another incorrect approach that emphasizes the role of MHC class Roman II in presenting antigens to CD8 plus T cells is fundamentally flawed from an immunological standpoint. MHC class Roman II molecules present peptides to CD4 plus T cells, not CD8 plus T cells. This represents a significant failure in understanding basic immunology and would lead to incorrect diagnostic conclusions and potentially inappropriate therapeutic decisions. A further incorrect approach that neglects the role of antigen processing altogether and focuses only on MHC molecule expression levels would be insufficient. While MHC expression is important, it does not explain the specific mechanism of antigen presentation to T cells, which is the critical factor in immune recognition. This approach would fail to provide a mechanistic explanation for the observed immune response. The professional reasoning process for similar situations involves a systematic evaluation of the clinical presentation, available laboratory data, and fundamental immunological principles. Professionals should first identify the core immunological question being posed. Then, they should consider the known pathways and molecules involved in the immune response relevant to the clinical context. Finally, they should critically assess each potential diagnostic or therapeutic strategy against these established principles, prioritizing those that are mechanistically sound and clinically relevant.